So my name is Ngiare Brown. I'm a Yuin Nation woman from the south coast of New South Wales. So my grandmother and my father's country is around the Shoalhaven in Nowra. I'm a doctor by trade, but when I want something I'll use professor. And I'm currently doing consultancy work for Winnunga Aboriginal Health Service in the ACT, but I work generally in Aboriginal health, in research, in policy and advocacy. I mean, I have a real interest in child and adolescent wellbeing and all that that encompasses, so that we know that the very early years, even from conception and preconception, are incredibly important. But if we look at from the very first breath, even to the third birthday, for example, the way that our children grow and develop and their pathways are being, developed is incredibly important. And also adolescence, it's a key transition period. So we always talk about how important it is, and yet there's very little work in that area, particularly for Aboriginal and Torres Strait Islander mobs. So how do we look at the social, the emotional, the physical and the cultural development of our young people? How do we support them, build resilience? How do we connect them with culture so they have a better sense of self, of identity, and then we can actually improve their outcomes across the social and cultural determinants of health? If you look at the way in which we've been able to develop services that are specific to Aboriginal and Torres Strait Islander people, but also are inclusive of all others, I think we actually do things better. We come from a perspective that isn't just medically orientated, but it's very much about the social environment, how people are in terms of their health, as well as their well-being and what that means, where they're living, how many people that they're looking after, all of the other concerns that they have as part of, day-to-day life. We all do it, right? But if you look at the way in which Aboriginal services, our health services in particular, have been developed, they're inclusive, they are comprehensive, they don't just deal with individual body parts or particular issues or writing scripts for one disease only. We try and provide the platforms and the supports for people and the way that they exist, taking into account all of their history and what we hope for their future. And so I think that historically Aboriginal services were developed specifically for our mob from a political perspective as opposed to a purely health perspective. Does that make sense? But they've evolved over time. And so by having our own services, we know that we are more culturally competent, we are inclusive, we have staff and other practitioners, Aboriginal and non-Aboriginal, that understand the experience, whether it's empathy or whether it's lived experience of Aboriginal staff, then they know we're starting from the same point going forward, and then hopefully we're able to provide better services. And quite frankly, I think the way that we do things in Aboriginal services can actually enrich practice across all disciplines, but particularly in health. So whether it's a primary care service or a secondary or tertiary referral centre, if they were to be as inclusive, if they were to better understand their clients culturally as well as socially, they're better connected in terms of that continuity of care and an interest in the pathway of the individuals and the families that actually become part of their practice, then we would actually have better outcomes for Aboriginal mob, but for everybody that accesses those services. I think there are some measures for which we've been able to do particularly well, and I know there's reporting on the reduction in the disparity in life expectancy for Aboriginal and Torres Strait Islander men and women when compared to non-Aboriginal men and women. I am sceptical about some of the jurisdictional changes, for example, because of course we know that they changed the formula sort of along the way. But I do know that with specific intervention and Aboriginal specific services, we can actually reduce the disparity very quickly and do that well. We've also been able to reduce infant and maternal mortality, for example. It's still slightly higher than for the non-Aboriginal population, but we also have to remember that that was through the implementation of common practices that we'd been doing for the rest of the population anyway. So once we actually start receiving best practice care, it can make an enormous difference. We know for end-stage renal disease, for example, if we screen and diagnose and then intervene very early, we can halve mortality within a decade. It's extraordinary. So why aren't we then implementing that kind of evidence-based best practice? I think that we still have a long way to go because there's a real hesitance and there's this real risk aversion within departments to being bold and going completely sort of, gonads out. If we want to get to eliminating the life expectancy disparity by 2030, if we want to then close the gap in health outcomes soon thereafter, then we need to be bold. We really need to commit ourselves. The departments and the governments and politicians need to commit themselves, not just worry about a 10-year anniversary and a piece of cake, which would be nice, but it doesn't actually save Aboriginal lives. It's completely doable. It just requires high-level will, commitment and resourcing. We have all of that expertise, so I think we can do better. The other enormous gap that still exists then is how we translate what we know into policy and have that resource going forward. None of this pissant 1, 2, 3-year funding or policy commitments. This is long term, and we're very lucky that at the moment with the Aboriginal and Torres Strait Islander Health Plan, it's a 10-year plan and we're looking to have it resourced for much longer so that it's bipartisan, multi-partisan support for something that will significantly change outcomes in Aboriginal health. I would say that if there are any young Aboriginal and Torres Strait Islander women that are out there, considering a career in health or in medicine or any other related field, then there is absolutely nothing that would stop you from doing that personally. Find the people that will support you, and they will be all around you. I mean, I'm very lucky. I decided at a very young age, I was 7 or 8 or something obnoxious, that I really wanted to do medicine. I wasn't quite sure why. It was just something that I really thought I'd love to do. I had a family that supported me. I had a community that said absolutely, and we'll do whatever it takes. And then there were specific programs that would support and encourage and recruit, retain and graduate Aboriginal and Torres Strait Islander medical students. And I know that a number of other disciplines have that now. And there are a number of financial incentives, scholarships, bursaries and other social supports that will help people be able to reach their goals, whether that be in medicine, whether that's in any other discipline whatsoever. So don't think that there is nothing within you such that you can't do medicine. I'm the perfect example that you don't need to be that bright. You just have to love what you do, be passionate about it and commit yourself to the path.